What if the solution to your chronic pain, pelvic discomfort, or emotional numbness wasn't another prescription pill, but something natural, powerful, and still widely misunderstood? Today's guest, Dr. Joseph Rosado, is one of Florida's first and most vocal advocates for medical cannabis and psychedelic medicine. From emergency rooms to OBGYN partnerships, from hormone therapy to plant-based innovation, he spent decades pushing boundaries and giving people the tools to heal on their terms. But before we dive into this episode, you already know what time it is. Vibe with me, y'all. Welcome to the Empowered Plates, Empowered Lives podcast. Y'all, welcome back to another episode of the Empowered Plates, Empowered Lives podcast, the space where those in survival mode break free from pain, fatigue, bloating, and hormone chaos, finally reclaim their energy and rhythm naturally. Welcome to the Good Vibes Studio, Dr. Rosado.
Thank you. What's up?
Nothing much, Dr. Rosado, man. It's great to be vibing with you. And if y'all don't know, it's your Healthy Habits and Lifestyle Coach Jovonnie. Y'all, Dr. Rosado, your story is so dynamic. So you started in healthcare at the age of 16, went into chiropractic after a traumatic injury, and became one of the first to legally recommend medical cannabis in Florida. What gave you the boldness to challenge the traditional model of healthcare?
I am a rebel. That's it.
Say less. What was it about this route that you were so passionate about?
Well, it was interesting because I am what's considered a unicorn in so many ways, but specifically about cannabis. Less than 10% of the medical schools in the United States, and I would venture to say the world, do not teach about the endocannabinoid system. So that means that greater than 90% do not address the endocannabinoid system, do not address cannabis at all. And so in the middle of a pharmacology class during our toxicology section, we were talking about different drugs or illicit drugs. And the first one, of course, that they started with was cannabis. And they did speak about the endocannabinoid system. They spoke about the cannabinoid receptors. And for your studio audience that don't know what an endocannabinoid system is, let me go ahead and take a minute to explain that. We all vertebrates produce cannabis. We have a system in our bodies that produces cannabis and works on these specific receptors. And the purpose and role of that system is to maintain balance, to maintain what we say in medicine, homeostasis, or a level of balance. When there is a deficiency in that balance, then we develop chronically debilitating conditions. This has been well documented and published by Dr. Ethan Rousseau, a neurologist that is also an expert in medical cannabis. And he postulated that if there's a deficiency in the endocannabinoid system, what shows up? And the first three conditions that he named were fibromyalgia, migraine headaches, and irritable bowel syndrome. Upon further studies and research, he discovered that PTSD also falls in there, as well as certain mood disorders, failure to thrive in children, as well as other chronically debilitating conditions, which chronic pelvic pain would certainly fall in that umbrella. And so that being said, the majority of medical schools teach about the respiratory system, the cardiac system, the gastrointestinal system. They talk about your gut, they talk about the reproductive system, but they don't address the endocannabinoid system, which is intimately and intricately involved with every one of the major organ systems. because you have cannabinoid receptors in every organ of your body, from the top of your head to the sole of your feet and from your skin in. So it makes sense for us to support our endocannabinoid system. Now, if we cannot produce enough cannabis in our bodies because of the chronic pain, chronic stress, etc., then we need it from a source. And the best source would be from the outside in, or exogenously, since we cannot produce it endogenously. So that's a commercial break. Going back, so when I'm in medical school, pharmacology class, we talk about the endocannabinoid system, we talk about the receptors, and then that was it. Because right then they started with the traditional, myth of it's a gateway drug and it's going to lead to further addictions with other drugs, et cetera, et cetera. Because I don't buy a lot of things I'm being told, because I have an issue with authority, I went ahead that evening and went home and started, as we say in Spanish, tirando páginas para la izquierda, which means throwing pages to the left. I started reading and I started studying further. And in the pharmacological Bible, it stated, and it still reads the same way, that cannabis does not cause physiological dependence, more of a psychological dependence. So it's not like alcohol or nicotine or opiates, where if you use a little bit, you create a tolerance, you need more to have the same effect. Cannabis works completely differently. And so I put that as, another tool in my toolbox, but because where I was studying, it was illegal. It was 1999. The United States had just approved medical cannabis in 1996 in California. So it was still new in the United States as well. And so as a result of that, I just put it in the back burner. Fast forward to 2010, when it became medically legal in Arizona, one of my best friends reached out to me and said, "Hey, I want to start this, start a dispensary. I need a medical doctor to be my medical director to be able to set this up." I said, "What you say less." So we moved on, but circumstances beyond his and my control squashed that. And so I had to wait until 2014, where, as you know, as a former resident of the state of Florida, you know that that's when we started talking about the decriminalization of cannabis in the state of Florida, but nothing really came of it until 2016, because it didn't pass in 2014, and we had to wait until 2016 when it passed, and then it was signed into law in June of 2017. And that's where, I began recommending in late August of 2016, because we had some laws in the books, not what, Amendment 2 brought to light. We were under Senate Bill 1030, which allowed for medical cannabis to be recommended to individuals with 4 diagnoses: cancer, epilepsy, chronic conditions that cause seizures, chronic conditions that cause muscle spasms. So my first cannabis patient, whose ID number was 58, was the first in the greater Central Florida area to receive a low THC product to address her brain cancer. And then 3 months later, under the Right to Try Act, the first child in the state of Florida received medical cannabis. He received a 1-to-1 CBD THC product because he had a very aggressive head and neck cancer. And that's it in a very small nutshell.
Yeah, and that passion ran deep, Dr. Rosado. That passion really ran deep, especially to go this route. And so I really appreciate it. Y'all, if you got something out of that conversation already and you're watching on YouTube, I want you to make sure that you are subscribed to the channel. So that way this conversation is pushed out to more people who want this type of vibe and value. And if you listen on your favorite podcast distribution platform, make sure you give the Empowered Plates, Empowered Lives podcast a follow and a rating. So Dr. Rosado, I got a question for you. That myth that it's a gateway drug. Why do you feel like, because of all the science that's happening, you have all these states who've gotten behind it, why do you believe that it's still slow to be embraced, being that it's something that is natural and that, like you said, all major organ systems produce it and the body needs it in the event that there's some form of deficiency, and this is a tool that could potentially help?
Negative propaganda that began in the mid-30s by an individual of the name Harry Aslinger, Aslinger. I advise everyone to research that individual's name. He was the first drug czar in the United States and had an issue with Mexicans coming across the border legally, because at that time there was a Mexican revolution. And so certain individuals that crossed the border were using cannabis. And so the term marijuana, as you will read and learn, and it's way too deep for us to get into right now, but it is a racist term. That's why you only hear me use the term cannabis. You rarely, if ever, hear me say the word marijuana, simply because it is an actually racist term. But as a result of his negative propaganda, they created the movie called Reefer Madness. And in that movie, or not only in the movie, but in the promotion of that movie, they were talking about how if white women smoked cannabis, it was going to make them want to have sex with jazz singers, Mexicans, and darkies. Yeah.
I've never heard this before.
And that was pushed and promoted from that point forward. I went to high school in 1976. I graduated high school in 1980. My freshman year of high school, we watched Reefer Madness in my high school in the Bronx, New York. And that made an impression on me. I'm like, wait a minute, what the hell? But again, you're 14 years old. What do you know?
Right.
So, but as far as that propaganda, and so government officials gravitated towards that, religious leaders gravitated towards that. And then we fast forward to the 70s, where President Richard Nixon had also an issue with African Americans, Jews, and Hispanics. And he made some statements about cannabis in the United States. And then we fast forward to the 80s, where we had a president whose wife, her motto was just say no. And you may or may not recall the commercials of the egg. This is your brain. This is your brain on drugs, which was a big lie, because cannabis has been shown to have what's called neuroplasticity. What does that mean? It means that it can cross the blood-brain barrier, and by crossing the blood-brain barrier, it has there are cannabinoid receptors in the brain, and the cannabis works on these receptors in the brain, causing the formation of new brain cells. For years, we were taught that the brain cells you had was all you had, and if you drank alcohol, you destroyed them. Well, lo and behold, research is showing that cannabis has the potential to create new brain cells, as well as another substance that we're going to be addressing later on in the program.
And I feel
You
like that's
that little
interesting
segue,
that
huh?
yeah, I do.
Smile.
I feel like that's interesting that you brought that up, because I think I've always was told that you're killing brain cells if you were to smoke the cannabis. And I was like, okay, so now you're saying that it's actual neuroplasticity when it's in the brain, endocannabinoid system, and now you're saying it actually helps create new brain cells versus what you've been heard people say. And maybe it is about the propaganda. Maybe it is about people just not knowing enough about how this can be a wellness tool to support them in the event that they are experiencing pelvic pain, or like you said, I think you also said they use it for cancer. It was approved for cancer, epilepsy, muscle spasms, and I'm not quite sure about that fourth one that you mentioned. I didn't perhaps get that last one. And what was the fourth one at the original approval?
It's me or you, but I don't know if it's me or
Okay.
and chronic conditions that cause seizures.
Gotcha. Thank you for that. I appreciate it. So, y'all, quick fixes aren't healing. And if they work, then you wouldn't still be stuck in pain, battling fatigue, and wondering why nothing's changing. I know because I've been there, living with stage 4 endometriosis, adenomyosis, polycystic ovary syndrome. And I was just like pushing through the pain and ignoring my body's signals every single day until my body said, you know what? I'm gonna have to force this stop. I'm gonna force this shutdown. And that's the reason why I created my M to the third degree healing empowerment formula, rooted into mindset, mindful eating, and movement. The exact steps I use to regulate my cycles, minimize pain, and reclaim my energy naturally. And now I help other women do the same. So if you're ready to stop guessing and start healing from the root, join me for my free live training, The Empowered Reset. Y'all, this is your chance to learn the exact method I use with my clients to break the cycle of pain and fatigue. Check the show notes, register for the upcoming training. Now let's get back into the conversation. So, Dr. Rosado.
Yes, ma'am.
Why do you think that these conditions that you've personally seen, medical cannabis or ketamine, help with most profoundly? What are some of those conditions that you've seen that have just regularly been like, if I can just get everybody on board to better help provide this as a tool or option for people that they know can help, what are those conditions?
Well, as you may or may not recall, in the state of Florida, we have a list of what are called qualifying conditions. They are PTSD, post-traumatic stress disorder, multiple sclerosis, cancer, epilepsy, HIV, AIDS, Crohn's disease, Lou Gehrig's disease or ALS, and glaucoma. But the state of Florida also has a little sentence that not a lot of people know about, and that is any chronically debilitating condition that's equal to or greater than in severity than the ones named. So, for example, I didn't say anything about anxiety. I didn't say anything about depression. I did not mention chronic pain, because every one of those would fall under an umbrella of a similar chronically debilitating condition. So anxiety and depression can fall under PTSD. Chronic non-malignant pain would fall under MS, multiple sclerosis. Now, there's another qualifying condition, and that is terminally ill. Someone that is terminally ill is defined as an individual that has a condition that if nothing is done for them for 1 year or within 1 year, they will be dead. And it was because of that caveat in the law that allowed me to recommend the medical cannabis to the 15-year-old boy that was dealing with cancer, because he was terminally ill. He was already under hospice. He did have a morphine pump that was connected to his body. And so we were able to give him the medical cannabis in November of 2016. So the whole message here is that the way I view cannabis is it is an inclusion. It is not exclusion. I look for ways for people to be medicated, not to look for reasons or excuses for them not to get their medication, because that is a freaking crime. As you said earlier, it's natural. But are you ready? I'm getting ready to blow your mind. Are you aware that there is a U.S. federal patent for the use of cannabis for chronically debilitating conditions in this country?
No.
Yeah. So talk about the hypocrisy and the talking out of both sides of the mouth. On one side of the mouth, cannabis is considered a Schedule 1 drug, which is defined as a condition, a drug that has no medicinal value and is highly addictive. But on the other side of the mouth, there is a federal patent for the use of cannabis for chronically debilitating neurological conditions, which would include multiple sclerosis, Lou Gehrig's disease. Did I just mention those as qualifying conditions in the state of Florida?
You did.
There you have it. But yet, we've got that dichotomy. But now the real hypocrisy comes in play. A synthetic version of THC, known as dronabinol, is a Schedule 3 medication in the United States. What that means is I can write a prescription, send an electronic prescription, or have my medical assistant call the pharmacy and say, I'm calling in a prescription for patient X from Dr. Rosado. His NPI is this, his DA number is this, and we're calling in dronabinol in the amount of 5 milligrams to be taken 2-3 times a day for X amount of days, number X with 2 refills, and the pharmacist will fill it that quick because it's synthetic. It's not natural.
That's crazy.
Fast forward to 2018, where GW Pharmaceuticals presented Epidiolex, which is a CBD isolate. What does a CBD isolate mean? It's a substance that only contains CBD, nothing else, no other substances from the plant, just straight up CBD that comes from hemp. That came in as a Schedule 5, which is defined as highly medicinal value, no addiction, no addictive qualification, nothing addictive. A Tylenol with codeine is a Schedule 5, which I'm sure you got prescribed that plenty of times when you were dealing with your pelvic pain.
Actually, I got the Tylenol codeine after my excision surgery in 2020. So after having my surgery, and they found it was stage 4 endometriosis. It was on almost every organ, covering organs. My fallopian tubes were stuck together on one side. They removed this large cyst that ruptured, which led me to the emergency room. And they found adenomyosis in that left side of my pelvic area. And so it was on the bowels. It was everywhere. And after surgery, I guess you would think that you would have less pain. Shout out to my endometriosis conquerors and my adenomyosis thrivers. There were so many people I saw after hearing and getting this diagnosis, because I never heard about this prior to, dealing with pain every single day. And that wasn't me, Dr. Rosado. My pain came when my cycles would come and I would have to pass bios. That's when the horrible pain would come. Every now and then the sharp pelvic pain would come every few days with my cycle on, but not every single day. And I had a client who was in pain almost every single day, not when they were menstruating and when they weren't menstruating, which is why I always like to say this isn't just a period disease or a menstrual cycle issue. Like, it's a whole body condition that affects so many different areas of someone's life as well as their body. And you just talked about how each organ has its own system as well. And so I'm glad you said that, but I took it and I automatically felt nauseous. But like you said, in the state of Florida. And that's where, I was diagnosed. That's where I had my surgery. I was able to obtain that medicinal card, and I was able to get, and I would choose that. I didn't get as sick when I would go to the medical dispensary and go that natural route versus taking the Tylenol codeine. I would get more sick with the Tylenol codeine than I did the other route. And I was just like, yeah, I'm all for it. And I think it's interesting that you talked about the synthetic being able to be called in, no issues, versus something that's natural. And I feel like that's a theme. So it's not, I originally said that's crazy, but I thought it was crazy because, like, why are we still finding ways in a system to push against the natural or less processed things when they're always finding a way to put in processed foods, processed things, fake ingredients, just creating all of this unnatural things to put into our body that, they're just kind of pushing out there when there's, like, I don't know, it goes right back to that negative propaganda that you were talking about. Why are they keeping us so far away from the natural and things that are just available to help the body in a way that you would want it to help? And we all have our own decisions, and we're not saying you need this or you need that, but just being able to see people make it harder to get natural things less toxic, things less processed, I think is just out there. But I love this thing that you did say. You talked about inclusion and not exclusion. And when you're on a healing journey and you're really wanting to truly approach your whole life, your whole way of living, a holistic lifestyle, thinking about the body as a whole, you want things to be inclusive. You don't want to say, I'm going to take this and I'm not going to do that, or I'm not going to do this or that, when there's so many different things that kind of come together and make it more a dynamic approach. And I love that. And so speaking of that, you created this intravaginal spray and even help people infuse.
No, I didn't create it. I recommend it. I don't create.
I
didn't
create
it.
You have the product. You have the product of the intravaginal product, which I've never even heard of before. And I kind of want to get into that. And you say it really helps with pelvic pain, dysmenorrhea, and inflammation, like conditions so many women silently suffer through. Why do you feel so strong about this product, and why do you feel like not enough people know about it as a way to support them?
Well, it's one of the dispensaries in the state of Florida that created this product and sell it. The name of the dispensary, shout out to MUV Move. They are the ones that have it. And the name of the product is called Ease, EASE. And it is an intravaginal spray, and it is marketed for sexual health. And the reason why I'm so passionate about it is because THC, which many people do not know this, is 20 times more powerful than aspirin as an anti-inflammatory, and twice as powerful as hydrocortisone as an anti-inflammatory. Well, the biggest problem with all dis-ease or lack of ease is an inflammatory process. And so by utilizing something that's going to work locally, specifically in that vaginal area or intravaginal area, that's going to help reduce the inflammation, it's going to reduce the pain, and it's going to restore health to that area. Now, because that is the only dispensary that has that product, most dispensaries have gel capsules. And so if an individual lives in a place or in a city in Florida that does not have MUV near them, then what I have them do is use the gel capsules that people take orally to put that intravaginally, like an ovule or a vaginal suppository. They're made of glycerin, and so it's absorbed, it goes into the body. The body heat will dissolve that gel capsule, and now the product, that the oil that's within the capsule, is freed within that intravaginal cavity, which will help with the inflammation and will help with the pain. So there are two ways that I use this. When back in 2021, I partnered with an OBGYN who specialized in pelvic pain. And so the reason why we partnered was because a vast number of his patients were using the medical cannabis, and they were asking him questions on the use of medical cannabis, and he's like, I have no clue. Well, his office manager was the liaison for a cancer center. And so she and I knew each other very well, because when the program started in Florida, I became very verbal and extremely well known on the topic. And so she and I created a really good working relationship. Her husband is an attorney in Florida, and he refers a lot of his clients over to me so they can get their medical cannabis card and they can be legal in the state of Florida. So through that relationship, I was able to connect with this OBGYN who was very forward thinking and said, you know what? This is something that's going to help my clients. Go ahead, come on in, and I'll refer every one of my patients that are having these types of issues to you so you can manage and treat them in conjunction with what I'm doing. And so it was a really good relationship that we helped hundreds of women that were dealing with what you were dealing with.
And I love that breakdown. And I'm grateful that you took the time to really explain the partnership, the development, the importance, and the specialties that are all connected to really, like you said, forward thinking, forward living approach. I love that you talked about that product being able to help reduce the pain, reduce the inflammation, and restore health. I don't think we talk enough about restoration in regards to just reducing the pain, reducing the inflammation, but what else? You would want it to actually restore, get it back to the functioning that it needs to happen. And I'm glad that you said that. So I don't know if anyone else caught that. If you're still listening with us, drop restore in the comments. Restore, not just reduce the pain, reduce the inflammation, but restore your health. I thought that was really good. But it was something that you just said that it made me think about it. You were partnering with this woman who didn't know a lot about the tool, and she wanted you to be able to help them with their pain management, the pelvic pain, the hormone deficiency. I know you also talked about that as well earlier. But what did you see happening in some of those clients? And was there a specific way that you were able to treat them? Because I don't know if you had a specific formula, process, framework, assessment. Like, how did you know exactly what their body needs, knowing that our systems need different things, especially if they're deficient?
Right. So the mantra in the cannabis space is start low, go slow. And so we would start with the lowest dose possible and then work our way up. With the intravaginal spray, because it is a spray, I would have the ladies do a pump. One pump gives them 5 milligrams of medicine. And so we would monitor it that way. Now, a lot of the ladies complained about, that it was messy, that the spray, it would get all over the place. And I had read about cannabis infused tampons that are available on the West Coast of the United States. And so I read about it, I investigated it, and I figured, okay, well, if they have cannabis infused tampons, then why not use this intravaginal spray it on the tampon, and then insert the tampon intravaginally. It's going to be right in that space, and it's going to be able to be released and address and treat the situation the way it needs to be treated. During
Did
the
you see
menstrual
any, when you were doing your review, did you see any things that kind of made it a little bit more shocking or concerning, or things that may have didn't I guess some negative effects that anybody might have experienced that use the infused tampons? Because they talk about toxic shock syndrome. What, based on that research that what you were doing, because you heard about it, and I don't take you as someone who's used tampons before. Was there any hesitation, concerns, things that you needed to kind of navigate, or that you saw when you saw this research that was happening on the West Coast?
That's why I had an OBGYN as a business partner to run this by them and say, hey, I just came across this. What do you think? And as long as they change the tampons appropriately and correctly, the possibility and probability of TSS or toxic shock syndrome is minimal to none. Now, during the menstrual cycle, it was easy for them to, spray the tampon and introduce that intravaginally, because doing the gel capsules, that was way too messy for them. But then when they weren't menstruating, that's when they either could use the spray or use the intravaginal capsules, which both worked very nicely. And so we noticed a major improvement in the pain levels, which then in turn help them with their quality of lives, because now they're not in pain all the time. And by not being in pain, they're um, the chemicals that are formed in their brain that deal and control with their moods are normalizing. So now they're not bitchy. Or they can be bitchy, but it's not because of the pain. It could be for something else.
And then we can actually kind of get into the something else, because you were just talking about them working together, but you kind of talked about that pelvic pain linked to potential sexual trauma or psychological origins. What do you think we miss when we only treat physical symptoms?
The problem with medicine in the West is that we divide the body up into pieces and parts, and we're not looking at the whole, the holistic approach. There's more than one way to skin a cat, and you are more than just your sex organs. And if you had or you experienced some type of trauma as a child, whether you were sexually molested or abused or touched in an improper way, and you didn't know how to express it or explain it, but you have a memory of that, that will affect you down the road. And so you may put it in the back of your mind because it's not present, but then on the out of the clear blue, you're with someone that you feel comfortable with, that you feel attached to, connected. They touch you in a certain way with no malice, but they touch you in a certain way that stimulates a thought and a feeling. You may not be able to explain it, but you can feel it, and all of a sudden you react a certain way, and your partner's going to look at you and go, what did I do wrong? And in that person's mind, you're like, I don't know what you did or didn't do wrong. It just doesn't feel right. And that's where you have to go beyond the physical and go deeper into the psyche.
And I think, like, because like you said, you partner with so many other people within the specialty, like at what point are we having these conversations, with our patients, our clients, to know that, okay, like you said before, we have your capsules, you have the spray, you have these things. So yes, you have it, but you might be moody, but it has nothing to do with this. So it might be something else that's not processed mentally, emotionally, some form of trauma that is just suppressed, that hasn't, been addressed. And you find coping skills on when those moments do come up to help out. How deep does the conversations go in order to know and recognize that this is more than physical? This is where I've been able to help you, but this is what else you might need support from. Like we're at the OBGYN, now we're at Dr. Rosado at the OBGYN, like there's connections. When are we pulling in, or how are we assessing that this is bigger than just physical? Because I agree with you. This takes a holistic approach. When I think about my M to the third degree healing empowerment formula, it's mindset, mindful eating, and movement. There's things physically that the body needs to happen in regards to your movement. There's nutrition that needs to happen. Your body needs certain nutrients to function, the different organs, stuff that's happening. But that mindset, your thoughts, your feelings, your beliefs, all of those shape to your health, and they impact your health, as well as stress. Eliminating and minimizing stress management. You have to be able to know how to respond to it, or your body's going to take over and make its own response to it, or stay in an inflamed state. So how do we navigate understanding that it is a holistic approach. And even though you might be including this aspect, you're excluding the thought that there's some trauma, there's some unprocessed things, there's some toxic things that are still happening in your life that you also need to address for us to work together as a dynamic approach. What does that look like, Dr. Rosado?
What that looks like is somebody that's listening and not talking. Because you got to read between the lines. You got to hear what they're not saying, but they're displaying. And there's ways where it shows up. Case in point, today I saw a gentleman. Now, granted, it's not a female; he is a male. 79-year-old male, served his country as a Marine in Vietnam, and he was having conversations in my office today with his wife that his wife had never heard him say before, and they've been married almost 40 years. Because I was hearing things that he wasn't saying. I was seeing actions, activities that he wasn't verbalizing. And just I hit a certain button that triggered something. And it wasn't a negative trigger, it was just a trigger that allowed him to open up and explain something and say something that his wife looked at me and looked at him. She said, "We've been married almost 40 years and I've never heard you say this before." And his response was, "No one's ever asked me this question this way before." So it's a matter of being attentive to the individual. And the challenge, again, with how medicine is practiced in this country is that people become numbers. And because we have to see X amount of people in a day to make ends meet, to keep our lights on, to pay for our staff, to cover our expenses, we have to see X amount of people. We don't dedicate, and it's not an attack on the profession. It's not an attack on my colleagues. It's just how the situation has lent itself to be. I am fortunate in that insurances don't pay for medical cannabis visits. Insurances don't pay for medical cannabis as a medicine. So I have the luxury of spending a little extra time with an individual, touching on things, on points that they're going to be open to discuss. And what's interesting in the medical cannabis practice is that when I come out and I've got a waiting room full of people and I come out and I apologize to the patients and say, "Sorry for the delay. I had to spend a little extra time with this individual for whatever reason." I obviously don't give them details, but I just say I just had to spend a little extra time. And the same amount of time that I dedicated to him, I will dedicate to all of you. Invariably, I will get, "That's okay, doc. We're cool. This is cannabis. We're fine." And now, granted, not everybody's that understanding because, we do live in the real world. But for the most part, people are accepting and understanding because they all know what they're dealing with and what they dealt with coming into the office for medical cannabis and how they are treated in our offices and how they're spoken to. I'm blessed that I have an amazing support staff. Every one of my team members, when I'm busy, they take on the baton, and they carry the ball forward for me and keep the patients involved, and they communicate because they know how important it is for the patients to be able to feel comfortable and tell us pretty much everything that they need to tell us so we can help them at 100% and not get what they've gotten in the past, which is, "Okay, here's a script. Have a good day. See you in 3 months. See you in 6 months. See you next year."
Yeah, I love that. And it really boils down to the luxury of having the time to be able to listen.
Yeah.
And I really do like that. And knowing that there's something in your display that you just may not be saying. And again, that's active and attentive listening in regards to those questions that you're asking for more insight. And I think questions are so much more powerful than answers. at times. And I think that's what really helps shift those thoughts, those feelings, those beliefs, and empower someone to do something differently, to go after what you now know is valuable to them based on hearing them share their experiences. And so I'm really glad that you broke that down. So let's talk a little bit, Dr. Rosado, about menopause and these hormone changes. So when you think about what's the biggest myth about menopause that you wish women understood differently? Let's go there.
Women in the world, everybody thinks that it's a clock and it starts at a certain time and it stops at a certain time. So I'm going to share a story. I'm an only child. In 2010, I was just starting to get into the bioidentical hormone replacement therapy world. I found a mentor that was brilliant, had been doing it for 20, 30 years. And he was the one that pretty much started taking me under his wing and teaching me a lot of the stuff that he had learned, not only academically, but also experientially. And so I was in that space. Well, this one particular day, I'm at my mom's house and we're having lunch together. And I noticed that she just didn't look right. Now, my mom was born in 1940, so this was 2010. She's 85 now. She just turned 85 this year. So that was what? 2010, 2025, 15 years ago. So she was 70, if math serves me correctly. So I'm sitting there having lunch with my 70-year-old mother, and she's looking like hell. And I'm like, Mom, what's wrong with you? Now, granted, my mom is a bit of a drama queen. She is an Aquarian. And so, I have to take a lot of what she says with a grain of salt. And
Don't do Aquarians
but
like that too much
she
now,
just
Dr.
didn't look right.
Rosado.
Anyway, that being said, she's like, no, I just didn't sleep well last night. And I'm like, why not? What happened? And she's like, oh, I suffer with hot flashes. And I'm like, hot flashes? You're 70. What are you talking about? And she's like, I've been dealing with hot flashes for 15 years. I about dropped my jaw. I'm like, what? She's like, yeah, I've had hot flashes on and off for 15 years of my life. She's like, I don't know any different now. And I'm like, holy crap. Because I was taught in school, perimenopause, 30s to 40s, menopause, mid 40s, ends mid 50s. They're golden. Women are fine. No issues. And here she's telling me this. I'm like, so I'm scratching my head going, okay, well, I'm going to have to put you in touch with my buddy Rudy because I can't, I'm not going to treat my mom. But then she decides to get even more verbal and starts talking about her vaginal dryness and her pain during sexual intercourse. And I'm like, I don't want to hear this. But she has no daughters. I'm it. And I am a doctor. So I listened to what she had to say. I called my friend. We, had a conversation, the three of us. And so he's like, well, what are you calling me for? You know what to do. I'm like, she's my mom. I have no leverage here. I have no power. I need your help. And so we worked her up. We did the lab test. We checked out what her levels were. And sure enough, her levels were in the toilet. And so we created a program for her. And between the two of us, we got her somewhat stable. And, she's not the most compliant person in the world. And I know when she's using her medicine and when she's not, because I'll walk into the house and I'll see the face, I'll see the bags under the eyes. I'll know she's not sleeping, and I know what she's not doing. But that's the biggest myth, that it's a stop and start, and there's a fixed stop and start. It don't work like that. And like I was taught in medical school, and I tell all my patients, your body did not read the textbook.
Ooh, that's a good one right there, Dr. Rosado. Your body did not read the textbook. That sounds like something we need to be telling when the doctors aren't trying to listen to us, when we're telling them what our experiences are and they're trying to say, oh, okay, well, that's normal, or there's nothing I can do for you. My body did not read the textbook that you studied. So let's have a little bit more grace and time to listen to me and ask me more questions to really get to a deeper level. So I like that. Your body did not read the textbook. Y'all drop that in the comments. If you're still with us in this conversation right now, drop that in the comments. I want to make sure y'all receive that too, because that is so powerful, because it shows that all bodies are complex and everybody has their own unique experience in regards to what's really happening. And I say it all the time. People see other people doing different things and they think it's going to work for them. That's their plan. That's their personalized journey and what tools they're utilizing. Doesn't necessarily mean it's going to align to work for you and what you have going on and what your body is responding to. And so I really am glad that you shared that. I also love the fact that you talked about her sharing her experiences and seeing the signs and then what those symptoms actually look like. And I think that's powerful too. So thank you for sharing that. And then saying you had to create a program. And again, there was some collaborative effort. So I guess my next question is, when a patient comes to you completely overwhelmed by their symptoms, chronic pain, trauma, anxiety, fatigue, how do you help them choose the right path without feeling even more confused?
I tell them it's all in their head. No, I'm messing with you. I'm messing with you because I know you heard that once or twice.
Say it a little louder. Yes.
The way I treat everything is they say how you treat one thing, you treat everything. And so I'm big into algorithms, I'm big into processes, I'm big into hierarchies. And so they'll come in with a host of conditions. And I'll break it down to them and I say, okay, of all these things that you've mentioned, which is the number one thing that if you had a magic wand and you could erase right now, what would that be? I'm not going to impose what I think is the most important. They're going to tell me what the most important thing is. And invariably, when we address that one thing, about 80 to 90% of the other things resolve. But it's a matter of listening to the individual and taking into consideration, what is your biggest concern? What is your biggest problem? Now, because this isn't a matter of life or death, I have, again, the luxury of time. It's not like when I was a paramedic on the street. It's not like when I was a cath lab technician dealing with a heart cath and they have a heart attack on the table, or they stop breathing, or their heart goes into an abnormal rhythm, and you have to jump and address the emergency at that point in time. And that's where you assume the role of you take the control. When someone has the ability to communicate and engage in a conversation with you, now we can work together and say, okay, what's the most important thing to you, for you? What is it that we need to address based on your needs, wants, and desires? And then once they tell me, that's where I say, okay, well, you're complaining of this, or you have this. Do you see how this could be related to this other symptom or this other condition? Because when you're neck deep in shit, you're not going to see beyond where you're at, And case in point, I'm talking real nice right now, but right before you and I were on the air together, I had a really shitty day. And I got home, and I was not the best partner to my girlfriend, and I was a bit of an ass. And but I was, because I'm up here in my crap, and I was not seeing beyond what the situation was at the moment. And just like that happened to me today, it happens to people. My advantage was that it only happened today. My patients are dealing with this, like my mother, for 15 years of hot flashes, and her telling her male OBGYN, I'm having hot flashes, and him telling her, there's no way. You're 70 years old.
Yeah. That's
So it's
powerful.
so it's taking it's honoring and respecting the individual.
Honoring. That's it right there. Honoring the experience, honoring the person, honoring your body, honoring the choices, honoring the lifestyle that you want. It's in the honoring of that. You have to honor it first. And I think that's a big thing. And you have to be aware of it. But it helps when you can have somebody that sees a different perspective, that can listen from a different lens and provide you insight on things that they don't know or they may not know. But I think it's even more powerful that you start where people believe is most valuable to them, because that's when they're ready for a shift to happen. They're paying attention and they're being more intentional. Just because you see other things or where they need to start, it's only where they want to start, where their interest lies, that you're going to get the momentum to be able to affect and change all the other things. And I think that right there was like the biggest piece that I got out of that story and that dialogue. And I really appreciate you still being able to have such a bad day, but still come and pour out and pour into so many other people to help them live forward with a more inclusive approach based on what it is that you're sharing. And I kind of want to say, what do you wish every woman knew about her body, her hormones, and her healing potential that they don't currently know?
That they're in control.
I love
They're
it.
in control of their body
And decisions,
and
choices,
decisions.
even
Yeah.
when their body feels like it's operating without them and everything's just going array and there's this chaos that's happening, there's still a level of control that they have. And so I'm glad that Dr. Rosado just reminded you that you're in control of this thing. So I'm about to get into this segment called Vitality Sparks, Dr. Rosado. And so I want you to just have some real short, rapid responses as I ask the questions. All right.
Okay.
So what's one myth about cannabis you'd love to debunk for good?
Oh, it's a gateway drug.
All right. What's one thing about the female body more doctors need to understand?
That is complex as hell. It's I heard this once before, that the way to a woman's body is through her heart and her mind, because it's all connected. So it's not a vagina, they're not breasts. It's all, but a woman is not just a vagina and breasts. It's all together. And so, they may have had a really bad day, and it's affecting their hormones. It's affecting their mood. It's affecting their ability to lubricate. It doesn't mean that they don't love the individual or their partner. It doesn't mean anything. It just means that they're not present. And so the female body is an extremely complex. I mean, all our bodies are extremely complex, but the female body more so, because you guys do something that we don't do. You guys give life. You guys create. We co-create, but you are the creator. You create. You have this. One of my twins is pregnant right now, and she gives me updates every week when she goes to see her doctor, and she's due to deliver in October. And she was feeling really tired and really weak, And they found that the baby is about a week and 5 days older in size than chronological. So she's going to have a pretty big baby. And my daughter is very small. She's got small hips. She's tiny. And so I'm like, well, baby, that's what happens when you have a parasite inside of you. And she's like, damn, Dad. I'm like, it's like it's a boy. He's like, he's sucking you dry. But the complexity of everything that's going on in her body right now with that infant, and once that baby is born and delivered, and all those hormones drop, forget it. It's going to take her months to recover. And so that's the complexity behind the female body.
Thank you. Wasn't as rapid, but I really loved the breakdown, and it was definitely highly valuable. And I hope the listeners got that. Here we go. What's your favorite breakthrough moment with a patient?
When I see the lights come on, like you're talking to them, and all of a sudden, like there's this like curtain, and almost instantaneously you say something or you suggest something, and all of a sudden it's like, oh, I never thought of that, or I never looked at it that way, I never considered it that way. Those are the fun parts, because you're in tune, and you've got that connection.
I love it. What plant or protocol do you believe more people should be open to exploring?
Whatever works.
Okay.
Whatever
What
works.
gives you the most hope about the future of women's health?
People like you.
Oh, thank you, Dr. Rosado. All right, so last two questions. Give some advice to the girl dads, the father figures, the role models, the partners, the spouses of those dealing with pelvic pain, heavy periods, fertility concerns, hormonal chaos. How could they be more a part of the support system and journey and conversation?
Just be there and shut the fuck up.
All right. If you could have a meal with any historical figure, who would it be and what would y'all eat?
Ooh, Pope John Paul II.
Okay.
Because that individual, for those of you that are not old enough to remember, he was shot. He was a pope that was shot back in the 80s. And after being shot, I mean, he was brilliant. He spoke multiple languages. He was very instrumental in doing a lot of different things. And yeah, the Catholic Church has a bad rap or whatever, but he, as an individual, truly demonstrated what a servant of the Creator should be and do. And after he was shot, and after he ended up with a colostomy because he was shot in that area, and he ended up having to poop in a bag for the rest of his life in the world. But he took the confession of his assailant, the person that shot him. He did his confession and forgave him.
That's powerful.
That's badass.
It is.
That's badass. And what would we eat? We would eat at a 3 Michelin star restaurant in Rome, Italy. The name of the restaurant is called La Pergola, Lapergola, La Pergola. It sits on the top floor of the Waldorf Astoria, and from the balcony, you see the dome of St. Peter's Basilica. So he wouldn't have to travel far, because we would be in Rome, just down the street from where he resided, and we would have us a tasting menu prepared by the chef, and that's what we would do.
I love it. All right, man, that was an amazing conversation, Dr. Rosado. Let everybody know where they can find you, connect with you.
Absolutely. It's real easy. It's my name. My website is josephrosadomd.com. That's josephrosadomd.com. On there will be a way where you can either shoot me an email or there's a phone number on there. You can either call that number or you can shoot me a text message to that phone number. And within 24 hours, either my staff or I will get in touch with you.
I love it, man. It has been an absolute joy having you on the podcast, Dr. Rosado. Y'all, it's your healthy habits and lifestyle coach, Jovonnie, coming to help you disrupt all those inflammatory vibes happening in your lifestyle, but also provide you with some empowering conversations and vibes to help you embrace forward living, forward vibrations for a better life, y'all, because you deserve it. So take the conversation, use it to empower you on making your decisions because you are in control. But thanks for vibing with us, y'all.